And now we are switching into English. Our next speaker is the leading voice on this subject in Europe. Tadeusz Hawrot has founded Psychedelic Access and Research European Alliance, and today being the day when all over Europe people can sign a petition that the European Union should start taking those issues more into consideration and more into research. These are the topics, but the main question still is, why is Europe behind America, Australia in these issues? So these are the questions we would like to hear. Thank you.
Thank you. Hi everyone. Thank you for having me here. Thank you to Oliver, and congratulations to TAIP for pulling together this fantastic event. So we will take a left turn in a way and go from science, from computers, to kind of the policy-making world and to Brussels to some extent. But before doing so, I just want to mention a little secret. I'm very happy that I'm here for many reasons, kind of coming back after more than a decade, but PAREA, which I'll speak about, is fully remote. So I had the freedom to choose a place where we would be incorporated or legally constituted, if you like, and we are actually legally constituted here in Estonia. Very happy about that. Okay. So I will speak about psychedelic advances in the European Union, and the presentation will be about, there will be 3 blocks. The first one will speak a little bit about PAREA. The second will give you a bit of a lay of the land in terms of the EU institutions, and finally, most importantly, I will be speaking about what's been happening in the EU in this regard. So this is PAREA. PAREA stands for Psychedelic Access and Research European Alliance. It's also a Greek word, just like psychedelics, and it denotes this notion of being together, of spending time together with friends. So it's about connectedness, it's about community. I think, so we focus on a future prescription use within clinical context, and we also make an effort to really legitimize psychedelics as just a branch of science like any other, and a branch of medicine. We hope that they will be soon seen like any other evidence-based mental health intervention. And what really helps with this is that we have all these different organizations engaged. So we are a multi-stakeholder, multidisciplinary alliance. I'll speak a little more about some of these organizations in one of the coming slides, but I also want to mention that besides the main members, we have this category which is community supporters, where we now have over 20 organizations. That's a snapshot, and we are happy to have TAIP also included. So this is our mission, really. It's having psychedelic therapies included in mainstream healthcare services where they are available for people at the place where they live, from the doctor that they trust, and covered by health insurance in the future. This is PAREA's executive team. Professor David Nutt from Imperial being our chair, and then you see involvement from some of the mainstream EU Brussels organizations. So it's really sending a very clear message to the policymakers. Same with our board. Earlier on we heard that there is some skepticism from psychiatrists. Well, the president of the European Psychiatric Association wanted to be on the board. You know, it was not our idea. He submitted his nomination. So I think there is still kind of uneven distribution of enthusiasm and skepticism in a way, but there are reasons to be also kind of optimistic, because there is this interest that we also have in the board. Past president from the European College of Neuropsychopharmacology, a patient organization, European Federation of Neurological Associations, so that's very important again. This is a bit of now moving to the EU, of a EU kind of infrastructure. where PAREA is trying to effect change, because these are the organizations that legislate. The majority of laws in member states are decided in Brussels, though it's not exactly the case. It's not so straightforward with health. But you see here 3 main EU organizations that have these legislative and executive powers. There is the European Parliament, which is the only democratically elected EU institution, and I'll speak about what we are doing in the Parliament. There is the Council of the EU, which brings together member states, including Estonia. And finally, there is so the Council is representing the interest of countries. And then there is the European Commission, which is kind of an executive arm and represents the interests of the European Union. And it is the European Commission that, on top of having kind of ministries, if you like Ministry for Health, it's called Directorate Generals, Research, and so on. They also have executive agencies, and among them, European Medicines Agency. And the EMA is this kind of funnel, is this legislator through which psychedelics will be legislated and made available in the future, hopefully, for Europeans. So we have this central regulatory approval mechanism through EMA, but it's not as simple as that, as you will see soon on the slides. And by the way, as you can see here, there is kind of these different circles. It's how the new laws are passed through this kind of conversation that these 3 institutions have. Now, mentioning EMA, I just want to mention that we have an issue with innovation in mental health, and we also heard about this earlier today. And just to give you an example, in the last few years, so this is from 2021 to 2023, because there is no data yet for 24. We had 1 new treatment approved in psychiatry and 68 in oncology. In 2024, in the US, FDA approved also 1 new treatment for psychiatry out of 50 new therapeutic agents. And everyone is actually very happy about that, because it's this new treatment for schizophrenia that is exploring new kind of therapeutic models. But, you know, I think we should do better. And one extra thing I wanted to mention is that there are a lot of discussions about FDA, EMA approvals, but we need to be aware that there is much more happening before we bridge these 2 kind of localities. The global, which starts with global decisions, ends at an individual patient, but there is a lot that needs to happen before these treatments reach patients. And, you know, this slide alone could be a subject of a separate talk, but I just want to mention something, and there is no good way of, you know, the way presenting it. There are huge access inequities in Europe. We have, you know, common market in the EU, but this is not exactly something that applies to kind of equal opportunities for people, for patients in different countries. And so once the European Medicines Agency approves the drug, it will take a certain time until it actually reaches patients, goes through all these layers of the pyramid. And here you can see how many days it takes in different countries. Unsurprisingly, Germany is first. The patients will see new treatments on average 128 days after they are approved by EMA. In Estonia, it will already be 518 days, and you have some other countries that patients have to wait for years. And there is another indicator, which is counting how many treatments are available at all on average. And again, here between, it was between, I think, 18 and 2021, there were 168 new drugs approved. Germany kind of rolled out almost most of them, and Estonia is a little bit towards the end. So what that means is that, of course, on one hand, drug developers are prioritizing bigger countries. You know, you have a bit of less bargaining power, but also it's about the readiness, you know, how ready a country is to adopt new treatments. And I think in psychedelics, actually, there is a lot that you can be doing in advance to somehow educate and engage with regulators and policymakers so that there is more readiness to adopt treatments in psychedelics after they are approved. But I think it's important to know we are still, it will be still quite a few years before the approvals and before the actual availability. So we should know this and in a way adapt our work and engagement to that end. So with this, I now want to speak about what has been happening in the EU. And indeed, when I was founding PAREA more or less 3 years ago, there was virtually zero discussions, zero interest, at least at the political level, because we are really doing well in Europe when it comes to science, when it comes to research, and we heard today, an example of this from Estonia. But we need also to start these discussions among healthcare professionals. We need to win trust and engagement from scientists, from healthcare professionals, from policymakers, and from the EU institutions. And so when PAREA was starting, there was literally zero awareness and zero initiatives in Brussels. But I'm very happy to mention that after a few years, there's been an enormous change, actually. And I actually believe that we can, in a way, we can do better than the US. We don't have to, in a way, wait for what's happening there and kind of imitate and, copy. We can develop our own frameworks, which can be more robust, more safe, and kind of more adapted to our realities. So with this, here you can see in the first slide, speaking about Europe, the number of clinical trials that are happening in this space. One thing is the number. It's been 29 in April last year. Now I'm sure it's more than 30. But another interesting thing is to see the dynamic of how it's growing. It's almost doubled, as you can see here, in a period of 1 year, more or less. So I think that kind of tells us something. And this is really a backbone of all the efforts. There are no shortcuts. We have to go through these hard, arduous clinical trials, which are time-consuming, because we kind of why psychedelics would be an exception if we are so determined to show to the public that they are like any other medicines, then we have to also, in a way, follow the regulatory standards. So clinical trials are very important. So there are different EU institutions, and there is one that is actually, in a way, championing this topic, and that's, again, the European Medicines Agency, or EMA. Here you can see their chief medical officer, Stefan Tierstrup, who has been, since many years, couple of years, quite supportive to the field here. This is an excerpt from his LinkedIn post, which is titled "A Second Chance to Psychedelics," but it goes beyond just the LinkedIn posts. EMA has co-authored in the last couple of years a few papers and commentaries in prestigious journals like The Lancet, where they are cautiously optimistic, but of course, speak both about the therapeutic potential in the context, especially of unmet needs, but also challenges that we should be addressing as a community. They have last year started the process of revising the depression guidelines, and there is a dedicated chapter to psychedelics. I think the guidelines probably are yet just to be published, the updated guidelines. I was told by the EMA that because the guidelines haven't been updated for more than a decade, and they said that actually it's because of psychedelics, because of ketamine, because they only update them when there is kind of sufficient progress, and there hasn't been an awful lot of innovation happening in this space in the last few decades, but now they are updated, especially reflecting the advances in the area of psychedelic science. And then a very important event took place last year. Maybe I will have time to provide a little bit of color and context. So PAREA is cooperating with the European Parliament, and we've seen EMA as a natural champion, and we wanted them to do certain things, starting with bringing all the stakeholders together. So we had a few calls with Stefan. We were telling him, organize an event. They were saying, you know, we will. And then we thought we'll kind of give them an extra encouragement. So PAREA wrote a letter that was then co-signed by a number of members of the European Parliament from different parties. So officially it was not a letter by PAREA, and it was sent from the European Parliament to EMA and also to EU Drug Agency, asking them to start doing more in this field, asking them to start cooperating. And then the executive director of EMA replied saying, we will organize this workshop. So that was, you know, very encouraging, and we've seen the workshop taking place in I think April last year. 2 days in the headquarters, kind of very prestigious, and this event put psychedelics on the map of many institutions and member states for the first time, because obviously EMA is kind of a badge of quality, and if EMA is doing this type of work, then it's a clear signal to a lot of stakeholders that you know, this is really coming, and we should start thinking what it means for us, what kind of questions we should be asking ourselves. And then there was this comprehensive report released after the workshop. If someone really wants to have a deep dive and understand the thinking of regulators, it's a interesting read. I mentioned challenges just very briefly because this is not what my talk is about, but these are, broadly speaking, the type of challenges that EMA is identifying. And again, this is not to say that there is something inherently wrong with psychedelics. It's just a new treatment modality which doesn't fit very neatly into regulatory standards. And a few decades ago, regulators like EMA were created with a very simple notion of drug administration in mind. You know, you just take a pill, and we've quite evolved since then with all the digital therapeutics, with psychedelics and so on. So there is this kind of meeting halfway, and also recognizing, you know, that there are challenges at the intersection of regulation, law, policy, science, that we need to be thinking about to make sure that there are no surprises, like with maybe the rejection of the application in the US that we've seen last year. Now I want to mention, going beyond the EMA, that the European Commission has these opportunities to fund research through the biggest program is called Horizon Europe. It has just short of 100 billion euros over a period of 7 years going to different scientific projects. More or less 7 or 8% of that money is going to health research. And coinciding with the workshop last year, there was an announcement of this project. The first EU-funded proper large-scale project. This is a clinical trial with 6.5 million euro going to 19 partners who will be looking at exploring whether psilocybin can help with these 4 life-limiting conditions that you can see here. Palliative care is a framework, but I also like to think about them as life-limiting conditions because some of them, like multiple sclerosis, are not maybe associated immediately with kind of later stage palliative care needs. So this is fantastic, and I really sensed a shift in Brussels around that time in April last year with this announcement, which is again really mainstreaming and legitimizing the field because these are very prestigious grants, and with the EMA workshop. I'm also very happy to say that this is still informal, but in the coming months there will be a round of calls announced for next year proposals. And my contacts at the Commission told me that they wrote one particular call with psychedelics in mind. We'll not necessarily mention psychedelics in the call itself, but we will have another project. It's about mental health innovation, but I think we stand big chances to, again, have something similar, this time maybe for major depression or treatment-resistant depression. And I think this is probably my last slide. I also want to mention that this EU Drug Agency, which by the way is is a new executive agency which evolved from the European Monitoring Center for Drugs Abuse, based in Lisbon. They are also kind of looking at psychedelics as therapeutics, and they published last year these FAQs, which are, again, if someone, a policymaker here, asks you about psychedelics, it's always nice to provide these institutional sources, and I think that the drug agency did a good job at providing a balanced overview on the therapeutic potential of psychedelics. And I'm coming to 20 minutes. Yeah, so this is the last slide. Now going to the Council of the EU. There was this report from the Dutch State Commission on MDMA. They worked for 1 year. The report is a few hundred pages. And it's really important what happens in the member states, because EU, the health is kind of a prerogative and competence of member states. So what is a priority in Brussels is a reflection of priorities at the member states level. And I hope that, in Estonia, you will also be reflecting on what you could do to put psychedelics not just on the agenda here, but at the EU. And so here, this report provided recommendations saying that they think that MDMA specifically is safe and effective and should be made available as soon as possible to people in the Netherlands affected by PTSD, especially treatment-resistant one. Initially, they wanted to do what they called naturalistic studies, which would go a little kind of beyond the frame of clinical trials, but in the end, I think the government will be providing a few million euros to do a clinical trial. But, it's also a very important step on the way to access. So that's it. Thank you very much. Again, thanks for having me, and I'm looking forward to continuing this conversation during the panel.
Sure. We will have more questions. A quick question here. The campaign that starts today across Europe, the petition, the signatures, what could this campaign achieve realistically?
So just to kind of clarify that the campaign is not run by PAREA, it's done by the Psychedelic Care, but we've been engaged from the very early on and kind of helped to write the asks. The campaign is really important and really complementary to what we do, because PAREA is small and we mostly try to change things in Brussels, but we really need like a major mobilization and grassroots campaigns and creating education and this, kind of critical mass of support. And yeah, it will do just that. I think, kind of briefly speaking, it will be complementing, this. So we will have top-down and bottom-up approaches coming together.
So every signature counts.
Yeah, absolutely. And actually, I'm looking forward. I don't know if legally I can sign here in Estonia, but I'd love to, on this first day, to...
Yeah. We will have information on that a little bit later. Thank you very much, and we'll see you shortly here. Thank you.